Greg, you said you wanted to work on this other memory.
Yeah.
My uncle, he's in my room when I'm 8 years old. He's masturbating me forcefully, and I want him to be there, but I don't want him to be there.
Yeah. I needed the attention. I was desperate for the attention from a man. But I didn't like it. I didn't want it.
I'm Dr. Joseph Nicolosi, Jr., clinical psychologist. We're about to watch the Feeling State Addiction Protocol. Multiple peer-reviewed studies have demonstrated its effectiveness for a variety of symptoms like binge eating, even cigarette smoking. It's perhaps most effective when used with clients who've been sexually abused, like the young man we're about to watch. When performed by a properly trained therapist, sex abuse victims commonly report significant, spontaneous changes in their sexual feelings. The focus is treating the client's abuse memory, but the spontaneous byproduct is often a powerful shift in the client's sexuality. Throughout this video, I'll incorporate research findings on the links between childhood trauma and sexual development, as well as how treating trauma has been linked with spontaneous sexuality change.
I was just filled with this pain and loneliness, and he was a warm body, and it felt good.
Mm-hmm.
But I don't like him, and I hated him.
Right. But you had a good feeling.
Yeah.
Okay. What's the peak moment as you go back there right now? The moment when he's forcefully masturbating you. What's the most intense, good feeling? I know that may sound strange. If you can go back there and find whatever good feeling you can still feel in that experience.
I'm naked, and he's feeling me up. I'm in bed, and he starts to masturbate me, but I hate it, and I hate him.
Yes, I understand. Let's just set those feelings aside for now. We'll get to those later.
Mm-hmm.
Is that the peak moment, the masturbation?
Yeah.
Clients who were abused by a complete stranger will typically report only negative emotions about the traumatic event. However, in cases like this, in which the client was abused by someone he trusted, a family member, the client will often report a confusing mix of emotions. Love and trust toward the caregiver intermingled with negative feelings of betrayal and disgust. This confusing combination is often the result of a process referred to as grooming. Grooming is when a trusted figure pairs an emotion that the client needed, for instance, attention, with sex. This understandably produces a conflict within the child and later shame about himself because the disgust, anger, and arousal have become intermixed in the experience.
All right. And in that moment, if you really get into it, try to get it as intense as you can. Picture it's happening right now.
Mm-hmm.
Can you feel that good feeling?
Okay. Yeah. I'm right there. I've got it.
Good, okay. And what's the good feeling you're getting when you really get into that moment?
It's like I'm all he wants.
Okay, all right, you're doing great.
Like I'm desired. I have value.
Okay, good, good.
I feel needed.
Yeah, needed.
Wanted. I feel wanted.
Okay, wanted. And can you feel that wanted feeling really strong?
Yeah, definitely. It's like a 10 out of 10.
Okay, great. Now focus on that scene. We're going to go ahead and process.
Okay.
All right, so really go back to that feeling of feeling wanted.
Mm-hmm.
The therapist employs a specific sequence of horizontal eye movements. The client simply feels his feelings as he remembers the event and lets whatever happens, happen. This seems strange at first, moving your eyes while thinking of a trauma. Created by Dr. Robert Miller based on a therapy called EMDR, this approach has been supported by other studies, which we'll discuss later in this video.
Has that feeling of being wanted increased, decreased, or stayed the same?
It's less intense, it's decreased.
Okay, let's keep going.
The therapist helps the client reprocess his feelings in a specific sequence. First, the client's positive feelings about the event, then his underlying desires, and then finally the client's negative feelings. This sequence of reprocessing is crucial.
What do you notice?
Less, definitely, maybe like a 5 out of 10, because there's still something I want.
Okay, all right, so there's still that wanting feeling.
Mm-hmm.
Stay with that scene. Go back to that.
Okay.
Stay with that. Keep feeling that wanting.
The American Psychological Association concluded that for some individuals, childhood sexual abuse has associative and potentially causal links to having same-sex partners based on research that included a 30-year longitudinal study of documented childhood sex abuse cases.
Has that feeling increased, decreased, or stayed the same?
It's like a 0.
A 0, like it's all gone?
Yeah. Yeah, it says that the feeling's gone. But there's still the conflict of wanting to orgasm. That's still there, and it's pretty powerful, actually.
Okay, all right, you're doing great. So just stay with that wanting feeling. Okay.
Another recent study has identified links between trauma and asexuality, a condition which EMDR has been shown to be effective in treating. Horizontal eye movements have been shown to trigger spontaneous changes in individual sexual feelings, regardless of their gender or sexual orientation.
What do you notice?
I don't see him anymore. I don't see anything. I don't feel anything.
Okay, good, good.
There's still the feeling of being unwanted, the negative feeling. I don't think he ever really wanted me, if I'm honest. I think I always knew that deep down, but there's still that feeling of being unwanted, like no one wants to be close to me.
Mm-hmm.
That's the only part of the memory I remember, the hurt.
Okay, yeah, the hurt. And 0 to 10, how strong is that hurt right now when you think of that memory?
It's probably a 9.
Okay, a 9. And what negative words go with it?
That I'm unwanted.
And what positive words would you rather have?
That I'm okay.
Great, okay. Yeah, I'm okay. How true does that feel to you now when you think of the memory? I'm okay.
0. Not true at all.
Okay, all right. Go back to that memory. Feel the loneliness. Hold the words. I'm unwanted.
Though this approach can be powerful, most clients require multiple sessions since there are multiple aspects of the traumatic memory that need to be reprocessed. And of course, every client responds differently.
What do you notice?
It's definitely less. Yeah. Less pain. It's still bad. It still hurts.
Yeah, of course. You're doing great. Let's keep going.
Okay.
Stay there with that feeling.
Mm-hmm.
It should be said clearly, this approach, like the others we use, should only be performed by an attuned, professional therapist with formal training, and with a client who's emotionally ready. It can't be said more clearly. If you're a clinician, in accordance with the ethics code, you cannot ethically use this approach without professional training, especially when working with someone who's been sexually abused.
What do you notice now?
The pain is gone.
Great.
Yeah.
Okay. Okay, good. It's all gone. Is there any negative feeling?
No.
Okay, good.
Yeah. Good.
Yeah.
All right.
All right. Do you still want to go with those positive words? I'm okay.
Yeah.
All right. And how true do they feel to you now? 1 to 7.
Honestly, completely true.
Okay. Good. Do you notice any residual negative feeling when you go back to that scene?
No, I don't really feel anything about it. No arousal, no hate, no anything. It's weird. It doesn't really mean anything to me. It's a part of my story, but it doesn't mean I have hate or arousal towards it or anything. It's just, I don't care about it.
Sure.
It's done. It's over.
Yeah, it's great.
I can move on.
Yeah, perfect.
Yeah.
Really good work.
Thank you.
Great job.
Thanks.
Another method for reprocessing sexual abuse memories is an approach I created called the feeling state flash technique. It replaces the bilateral eye movements with bilateral tactile stimulation, in this case alternating contact on the knees. This approach is simply a hybrid of 2 existing evidence-based treatment approaches, the one we just watched and the other a treatment called the flash technique. Your first reaction to this film clip may be to think that it can't possibly be a therapeutic technique, it looks too simplistic. But when it's used by a trained therapist at the right moment with the right material, the results are often remarkably effective. The advantage of this approach here is that the client still gets the effects of the bilateral stimulation but does not need to deeply feel anything associated with his traumatic memories. Many clients want to resolve their traumatic memories but only minimally feel the pain of them. This is often especially true for clients who've been sexually abused. With this approach, the client never needs to deeply feel the discomfort of the traumatic event. He can process it from an emotional distance. Clients often report that this method helps resolve their trauma more easily for them. Other clients prefer the approach we saw in the earlier video. They report that they want more direct contact with the trauma memory that feels more natural to them. This flash method you're watching is designed to distract the client from the traumatic memory by keeping his attention on something positive and engaging. I think these 2 guys here are both talking about their favorite movies right at this moment. Meanwhile, the therapist here is guiding the pacing of the bilateral hand movements to help keep the client on track while they talk. During this process, the therapist directs the client to very briefly disconnect from their conversation so the traumatic memory can be reprocessed, usually less than 1 second, so fast it's referred to as a flash. Too fast for the client to even have a chance to consciously remember the trauma memory. And then they immediately continue their conversation, in this case, talking about their favorite movies. The therapist does this flash method repeatedly at specific intervals during the reprocessing. Here's a link to the protocol as well as references to the excellent original peer-reviewed published studies it's based on, studies which demonstrate the efficacy of these approaches. All the same cautions and limitations I mentioned in the previous example also apply here. If you're a professional therapist anywhere in the world and want training in reintegrative therapy, we offer specialization and certification for professional therapists worldwide. Contact us today and find out how to start.